Hey there, it's Dr. Taghechian with Aayla Sexual Wellness and Aesthetics. I want to talk about the origin of Aayla. How did it come about? Well, by training, I am a urologist. I've been a physician for 17 years now, and I have loved treating my patients with things like overactive bladder, stress incontinence, urge incontinence, interstitial cystitis, pain with intercourse, um, in my urology practice. And oftentimes we do really well in treatment with what we have available in the world of urology. But I find sometimes we're only able to get the patient maybe 75, 80, 85, 90% better in whatever ails them. And we can't make it to 100%. And that could be due to a whole host of issues. But I find that one of the biggest uh, hurdles is insurance companies, for example. Oftentimes, our hands are tied in what we can offer the patient. Either the pill we like is not covered, or the cream or the suppository that would actually help the patient is not covered, or they won't cover a surgery that the patient needs. Um, just various things, or frankly, we just don't have um, treatments in traditional medicine that could help these patients. My goal is to try to turn back the hands of time and get the patients to a place where they may have been 10 years ago, 20 years ago, where they were functionally healthy. And if I can do that, that actually fixes a whole host of things. It's not just like putting a band aid here on overactive bladder and putting a band aid here on recurrent urinary tract infections. It's really trying to get to the root of the problem, fixing the source of the problem to bring back um, sexual health and vaginal health and intimate health of the patient. And so that's where Aayla came along. I was able to break out of the boundaries of traditional medicine and offer more to my patients. So, for example, I offer restorative, rejuvenative, vaginal procedures. For example, I have Morpheus of the vagina and the vulva, as well as Forma V of the vagina and the vulva. These are radio frequency treatments of the vaginal tissue that ultimately help to bring blood flow. They bring strength by helping the body make collagen and elastin in these treated tissues. You have oxygen coming back, you have growth factors coming back. You start to restore the pH of the vagina, which helps to prevent bacterial infections of both the vagina as well as the bladder. And in keeping that vulvar tissue healthy, well, guess what? Its next door neighbor, the bladder, also becomes happier, and patients um, have improvement of their overactive bladder and their incontinence, their urge incontinence, their stress incontinence. So, if you can restore, regenerate the tissue, literally rejuvenate the tissue, then you're going to stop a whole host of diagnoses coming after you. So that's what I like to do here at Aayla. I also offer something called V-Tone, which is for pelvic floor strengthening or pelvic muscle strengthening. We, with pregnancy and childbirth and gravity and heavy lifting, our pelvic floor just it gets weak and floppy, and that leads to prolapse and pelvic pain. So using V-Tone helps to strengthen those pelvic floor muscles and brings that structure back to the pelvis. Um, and I offer some other pretty cool out of the box treatments for sexual health that helps women with increasing their pleasurable sensations with intercourse and all kinds of other things. But anyhow, that's how Aayla came along. And I'm so, so excited to be able to offer some of these therapies to my patients. And I'd love to see you here in the office so we can discuss what you'd like to achieve in your sexual and intimate health. Hope to see you soon.